Hello. We were discussing about a patient. In the previous lecture, we were discussing that a 20-year-old male, has come to your clinic with a complaint of headache. Okay. Now you have got a dry refraction of +1 in both eyes, and the patient is accepting plus 0.75 diopter under fogging. Okay. So he is reading 66 and 6 with that plus 0.75 also, and previously also when you have taken the visual acuity, he was reading without also 66 and 6. Now the patient's complaint is headache. So the question was that whether you are going to cycloplegic that patient or not. Okay. See, before cyclopleging the patient, you have to think about the patient, the consequences of cyclopleging the patient, right? So before doing that, cyclopleging the patient, calling the patient for PMT, okay, and all. So before that, you need to check the binocular vision status of the patient. How do you need to check it? So basic, whatever apparatus you are having in your clinic, you can check the near point of convergence, you can check the near point of accommodation, right? You can check the distance foria, you can check the near foria with the help of a Maddox rod you are having with your trial box, right? So now how to manage the patient complaining of headache. So suppose if you find that the patient accommodation is excess, suppose according to the Hofstadter's formula, the patient's accommodation, suppose it is 12 diopter at this age, so you are getting an accommodation of 13 diopter, 14 diopter, 15 diopter. Definitely if you are fogging the patient, and if you are giving the maximum plus, that will relieve that accommodative excess. Okay, if the patient is having a kind of, if his accommodation is higher, then we are going to prescribe that plus power what we have got in a refraction, what the patient is accepting. Okay, now what if the patient's accommodation is lower? Yes, accommodation is lower. So accommodation will be higher only because this is a case of a latent hypermetropia. So that's why he could read plano 66 and 6 also, right? So that may be like the accommodation might be higher. So in that case, we are going to prescribe the plus power. Now second case, secondly, if you are finding that the accommodation is normal, when you are checking the foria, okay, you can check it with the help of a Maddox rod very easily. You can check the near and distance foria. Suppose you are getting the foria to be, and the patient is having an exophoria for distance and near. Now you have to keep in mind, if the patient is having exophoria, significant exophoria for distance and near, especially for near, okay, the patient will have convergence problems. Definitely the patient is going to have convergence problems. Now in that case, if you are going to give that plus power to the patient, it will actually, basically what it will do, it will actually increase his headache. It will see, the patient has come to you with a complaint of headache. Your duty as a consultant is to alleviate, as to relieve the headache, right? He will not do anything that can aggravate the headache. Okay, so if the patient is having a significant exophoria for near, you need not to give that plus power, but please to check the accommodation also. Okay, you need to check the accommodation very properly. You can check the NRA PRA, you can check the patient's NRA PRA. If the patient is having a high PRA value, that means the accommodation is on a higher side, you can check the dynamic retinoscopy MEM value, you can check. If you are getting a lead of accommodation, you can do prescribe the plus power. So but in case of exophoria, suppose the patient is having only exophoria, significant exophoria for near, okay, so what is the thing you can do? You can give him some exercises for treating convergence insufficiency. Okay, So once you can treat his convergence insufficiency, or you can treat the convergence insufficiency, then he will get relieved of the headache. Okay. So what else you can do? See, if you are giving a plus power for in case of a near exophoria, higher or a significant near exophoria, what is going to happen? See, if you are going to measure the AC by A ratio, suppose the AC by A ratio you have got 3:1. Okay. So for plus 1 diopter of, if you are pushing plus 1 diopter power refractive, like if you are giving him plus 1 diopter refractive correction to the patient, it will increase his 3 diopter of phoria, exophoria, it will be increasing. If the patient is having esophoria, there is no question of thinking only. You can straight away give the higher amount of plus whatever you are getting. Okay. So but for an exophoria, you need to think about that. If the significant, if he is having a significant near exophoria or a greater near exophoria than distance, definitely you need to think. Now, if you are getting a patient who is having an accommodative excess also he is having a convergence insufficiency, in that case you need to giving minimum plus power and you need to treat his convergence insufficiency. Otherwise it will not improve his headache, it will not alleviate his symptoms. He will again come to you, or he will go to another consultant, that there is no use wearing the glasses, rather the glasses are giving more headache. Okay. So always think wisely before prescribing any patient. Okay. Always check his accommodation status as well as his convergence status. Okay. You can check the accommodative facility, you can check the vergence facility, you can do all these things also. Plus you need to check the phoria, near phoria. It is very easy, you can do it very easily with the Maddox rod, right? So you need to check the near and distance phoria status also before prescribing any kind of spectacles to any kind of patients complaining of this kind. Okay. Any questions you can let me know in the comment box. You can ask me, you can let me know in the comment box. Thank you all.